the knee must be bent at an angle of at least 90 degrees, so that by opening the medullary canal and during insertion of the unreamed nail, the patella is not injured. The following instruments are needed to open the medullary canal: a T-handle used for the 4 mm guide pin, a cannulated cutter with tissue protector. The guide pin with the T-handle is used to determine the insertion site on the proximal tibia. The insertion site is situated above the articular surface on the extension of the longitudinal axis of the medullary canal. The thin cortex is opened by rotary movements of the tip of the guide pin. The exact orientation of the insertion canal is important. To assist aiming, a nail is laid along the anterior edge of the tibia. The guide pin must be tilted in a dorsal direction until it lies parallel to the proximal part of the nail. Once this is done, the guide pin can be turned until it enters the medullary canal. After removal of the T-handle, the medulla is opened using the cannulated cutter. The tissue protector is placed over the cannulated cutter and pushed as far forwards as possible so that the sharp cutting edges of the instrument do not injure the soft tissue at the insertion site. The protector also protects the surgeon from the cutting edges of the instrument. On the model, we have deliberately pulled the protector back in order to show the cutting instrument being turned gently, and thus cutting through the cortex and entering the medullary canal. Opening the cortex must be carried out carefully. It is more difficult on an artificial than a human bone. Once the medulla has been reached with the cannulated cutter, it is withdrawn. On the artificial bone, the bone plug, cut by the cannulated cutter, does not always come out with the cutter. If this occurs, the bone must be unclamped and the plug of cancellous bone removed.